Hi everybody, welcome to week 3. So this week's DQ is facilitate learner development and socialization. So we know an awful lot about facilitating learner development, the teaching piece, increasing them intellectually. The socialization piece can be a little bit harder. We strive for certain things with socialization. We want our students to have a professional persona. We also really value honesty. We value going the extra mile, caring, those socialization pieces. And like I said, I think sometimes that's the harder part. So this week I want to talk a little bit about an aspect which is student nurse incivility. And I'm going to be attaching an article to this post that talks about incivility. And I'm going to focus on incivility in the classroom. I have seen episodes of incivility both in on ground and online, much less in the master's program, but on occasion. But usually in those students who are pre-licensure, not yet nurses. And so a few things that I've looked at, and some of them in the articles about trying to nip this in the bud. First of all, classroom norms. I think addressing classroom norms at the beginning of a course, especially in the pre-licensure setting, um, negotiating with the students as far as classroom norms, how will we respect each other, how will we deal with disagreement. It's kind of like in your community learning, your CLCs, when you set up the contract, it's kind of like that. So setting up class norms. And then I think also really addressing things in a caring but firm manner when you see issues starting to arise in your classroom. So maybe if a student makes an untoward comment like in the on-ground setting, you could maybe say, now, Christine, how do you think you could revise that to maybe have that not come across differently than what you intended? Or in the online setting, post a note in the individual forum, this was what you said in your online statement, and copy and paste. This is this what you really meant to say? Is this the tone you were really trying to convey? This is maybe another way that would have been more respectful of your fellow student. So I think kind of addressing those right off the bat. Some students occasionally we get in class that truly are angry, and this could be the result of past trauma, perceived slights, who knows. But those students, we really need to pay attention and try to address those right away. In the on-ground setting, have those students coming in for an appointment, and in the online setting, calling up those students and having a one-on-one conversation over the phone, I found can be really quite helpful in kind of getting to the bottom of it. Sometimes students don't necessarily understand how they're perceived. They maybe don't understand class norms, or maybe they're just dealing with a struggle and we have nothing about, and they don't realize how it's affecting them in their academia. So this idea of socialization, it's huge. Way back in the day when I was in nursing school, part of our socialization was if a physician came to the nurse's station and you were sitting down charting, you got up and gave them a seat. I love nowadays where we have specific physician charting areas or provider charting areas where they can just go and take care of their stuff and they don't need to interrupt our areas, or having specific areas in the hallway where computers are. And anyway, that's just a little example. But nurses being actively involved in the plan of care for the patients. One thing that comes up with new graduates is that our students don't know how to communicate effectively with healthcare providers, physicians especially. And I think we don't get a lot of practice in the clinical setting with this. So, talking about things like SBAR, if students have a preceptorship, stressing that they need to be involved in those conversations with their preceptor so they can hear how those things are handled and addressed. So that's another area, I think, of socialization. And then this idea of teamwork, helping your fellow members of your team, respecting the fellow members of your team. Um, there's too many nurses out there who have the idea of black and white nurses duty, CNA duty, not appreciating a good CNA. For those those of us who have been around a while, your day can be heavenly or horrible, depending on whether or not you've got a good CNA working with you. So all those little pieces come into socialization, and sometimes they're not really a part of the core curriculum, but we need to figure out ways to include those so that we're really preparing our students to be able to function effectively in the work setting. So just some thoughts on this week's DQ. I hope you enjoyed the article. I am in the process of grading the assignments that you turned in, and I'll be sure to give you feedback on them. So on those sheets that you turned in, the regular NEPD and the overall practicum goals, I'll be filling in the faculty comments section, and I'll try to give you really specific feedback. Remember, this is just a communication tool between you and I, so it's a little bit casual, and I just want your preceptorship to go really well. So I'll give you feedback about what I think. You tell me honestly about things that are going on with your preceptorship, and I'm just excited to be with you through this process and to see what you learn. All right, so I look forward to seeing your comments in the main forum. Talk to you there soon.